country firmly now in the festive season, the Department of Health is calling on the public to help protect and support paramedics. This comes as ambulances and paramedics face attacks while they are on duty. For more on this, I'm joined now by the president of the South African Emergency Personnel's Union, Mpogeng. Mpho, good evening and thank you very much for your time. How severe and how rife is this behavior of attacking paramedics and certainly placing their lives in danger?
Good evening and thank you for having me. Let me indicate that the situation that our workers are working under is very, very dangerous. And some of the challenges that we are experiencing are actually caused by the very same department that is actually issuing statement that they must be supported. Of course, we welcome the statement, but they must do something. They must act. They must procure ambulances. Let me specifically talk to the issue of attacks. In most cases, when you find community members attacking ambulances, it's precisely because of the delays that are there. And the delays are caused by the shortage of ambulances. Because you can call an ambulance and an ambulance will respond more especially after an hour or two. And you'll find that people are already dead or something of that nature. So community members are impatient. While the department is failing to take responsibility and telling the community the truth that they are running short of ambulances. Because every time when they procure 5, 10, 6 ambulances, they throw big parties and create a very wrong impression to the community that they have enough resources. And when those resources are needed, they can't deliver. That is the main reason why the community they always have difficulties to understand the position of the EMS sector, and they normally resort to attack the ambulances. That is the biggest challenge, where the department, you are still urging the department to write the very same statement, tell the community the truth that they are running short of ambulances. That is the main approach in relation to what we're talking about.
Yeah. Though some of the EMS personnel come out of these situations unharmed, but they certainly are still quite traumatized by the experience. How does this affect their attitude in responding to calls, particularly in township areas?
Yeah, you see, the issue of attacks and the townships, we as the union, we're not in a position to tell the community, to tell our workers not to respond to such kind of hostile areas or hotspot areas. And our members are traumatized to such a extent that the department, after the very same incidences, they don't do anything about that. They don't do any counseling. The only thing that they'll do, they'll just issue statements to the media to say we condemn the attacks and so forth. We've been trying our level best in several occasions to talk to the very same MECs because they are deaf and blind. They can't hear those people. It is unfortunate because we voted for them. We tried our level best to engage them and come up with possible solutions for the very same challenges that we are facing. For instance, we've been talking about procurement of dashboard cameras. We've seen in the security companies, dashboard cameras are working. We've seen the arrest in KZN where one guy, perpetrator, attacked the security company, and the incident was captured by the very same dashboard cams. We have seen in Provinsdal, in my province, where the perpetrator stolen the security vehicle, and the car was recovered, and the very same perpetrators were captured on the very same cameras. Why don't the government or Department of Health procure the very same thing and see as to whether it's not going to work? But we have seen that in other sectors like the security, as I've mentioned, is working. So every time they'll issue statement because without procuring those things, and indicate that they are the only people who have powers to procure. We don't have. We only recommend. We also recommended the vest camps. We said they must procure those. We've been sitting in several meetings with them talking about the procurement. And in Western Cape, I may be specific with Western Cape. We met in Western Cape, in Cape Town. The manager promised that those things they will be delivered anytime soon. Even today, I think it's almost 3 years now as we speak. Talking about one and the same thing. In other provinces, There's nothing. Remember, our members, we lost so many members, not because of COVID, because of attacks. They shot them, some of them, they are killed and so forth. So there's nothing that is actually happening from the department. The only thing that you see is the statements that they are going to be issued and so forth. And we're sitting with a very serious challenge because the service that we are rendering is very, very poor. It's just that most of the public members, they don't know their rights. That is why the government is always safe. And if most of our public members know their rights, obviously the department will be broke today because they will be sued. Because in other provinces, if I can be specific, you go to Northern Cape, you operate with basic life assistance. The 99.9% of employees in Northern Cape are basic life supporters. And you also go to Mpumalanga, if it's not 90 in Mpumalanga, it might be 98%. So you can easily see that the department is not doing enough. Our members, the service that they are getting is very, very poor, precisely because they don't do anything about skill development program. EMS has collapsed, and you don't have to be ashamed to say that. Yes, collapsed in the very same hands of doctors who are not doing anything about it, and they claim that they know and they belong to the theaters. They are not good MECs. Because if you can check, starting from the minister is a doctor, go down to all the MECs, doctors, and EMS has collapsed in their hands. I must indicate that.
So, Mpho, tell me, I mean, when you say that you're at a basic level, what type of service should you be offering the people at this point?
If we are talking about basic life support, we're talking about the person who's going to assist those who are having advance. They are assisting those who are having the advance to execute their duties. But in our case, those people are the ones who are doing the transfers. They take the patient, for instance, from Limpopo to George Mokari, from the very critical patients. They are taking patients from, for instance, in Northern Cape, they will take the patient from Falhards to Kimberley, or from Kuruman to Kimberley. And remember, that some of these patients, they've been in the ICUs, they've been taken care of by the doctors and so forth, and you drop that service or that care or you reduce it to somebody else who's having basic life support, who doesn't even allowed by the protocol to put a line, the IV line, meaning the IV line, let me say the IV line. So that its own is a very risky for the country, because now we've been talking about this thing for some time, that you cannot close the colleges of EMS. You cannot close the colleges of EMS because you are going to destroy the very same sector that we are having. And now it's gradually getting there, and we're having less number. Now all the provinces, KZN or whatever you mention it, they are competing for the very same ILS and the intermediate life supporters who are moving from one province to another and so forth, but they cannot educate others. So that is the biggest challenge that we are sitting in, because of the very same doctors who are leading the department. I must indicate, because we are not happy about the doctors who are leading and who are destroying the department.
Big challenges there. Mpho, I appreciate you and raising these issues. That's the president of the South African Emergency Personnel Union, unhappy with the current leadership in the Department of Health, who are placing the lives of EMS personnel at risk. Of course, the department, meanwhile, has issued a statement calling on the public to protect